tell me your name. Dustin. So I'm hanging out all day with these physicians. I'm helping them modulate their stress. Dustin's like, okay, we have to go see Mr. Williams, or the patient rather. We would talk about, how his stress level has been, and then he and I would get up. You don't need to get up right now. We would get up, and as we are walking to meet with the patient, we are modulating the stress of that interaction. Because what normally happens, as you could probably imagine, Dr. Dustin now, would never really do this, but so what normally happens with these physicians as they're walking in is they're going over the chart, they're trying to figure out what they're gonna do. So then what happens is they have no idea what's going on with themselves, right? Because they're so busy trying to figure it out. Well, Dr. Dustin has been doing this for 5 years, 10 years. He's brilliant. He doesn't need, right? He's been studying this case for 6 months, sometimes 5 years, right? So he doesn't need to be doing this thing, but because he feels some level of stress or wants to get it right, for Mr. Williams here, he's disproportionately thinking and not attending to himself, and certainly not attending to what's around him or what's in front of him. So the problem with that, unfortunately, is that stress level. This is where chronic stress comes up, right? So it's just, I'm thinking and I'm doing, and I'm not actually building in or allowing my body to modulate my own stress. Versus when we work together, instead of him just distracted and his brain's all over the place or checking his cell phone to see what the rest of his life looks like, or need to be able to figure out how to modulate the stress, because if we're just in this front part of our brain, it just builds and builds and builds. And that, when I'm working with Dr. Dustin, it is merely as we are walking from this room to that room back there, 20 seconds, he's just checking in into this breath, noticing what it feels to step. And then when he reaches for that door, 1, 2, there's just this last little pause to kind of do what Rich did, was because that's that reset of that nervous system. We just want to think about what are the systems in your life that some of these things could be placed in.